Hi guys, thank you so much for coming to this meeting. Today we'll be talking about our inner voice masks. We are Mask for the Masses, and our slogan is Unmask your voice, but not your mouth. We have been working on this project for a couple months now. We have been perfecting it for you guys to be the most trendiest, the most safest mask on the market. We will first introduce the COVID-19, and then we'll be talking about our product.
COVID-19, what an unexpected journey it's been. Severe acute respiratory system, also known as SARS-CoV, was first discovered in China in December of 2018. Since then, our day-to-day lives have changed. Our daily routines have turned into luxuries. Something as simple as going to the grocery store has turned into an event you have to prepare for. 9 out of 10 adults say that their everyday lives have changed. COVID has impacted our economy, pushed our hospitals to capacity, exhausted our healthcare workers, driven small businesses back into the ground, and killed over 1.5 million people. Many critical events have happened during the timeline of COVID-19 that we as a generation have never seen before. Wuhan went under quarantine, global air travel was restricted, the US declared a public health emergency, and we saw the epidemic get declared into a pandemic. Multiple stay-at-home orders were placed, and even the president has fallen sick under the virus. But how does this deadly virus work, and what can we do to prevent it? The answer is masks. I feel as if we as the general public know the gist of how the coronavirus is spread and contracted, but there are many things that would surprise you. An infection is transmitted by respiratory droplets generated when people cough, sneeze, sing, talk, or breathe. Both pre-symptomatic and asymptomatic transmissions are possible, which is why and how the virus has spread so quickly. I'm sure you've heard this a million times, but masks really do work. Here are some real-life examples. In one case, a man flew from China to Toronto and subsequently tested positive for COVID-19. He had a dry cough and wore a mask on the flight, and all 25 people closest to him on the flight tested negative for COVID-19. In another case, in late May, 2 hairstylists in Missouri had close contact with 140 clients while sick with COVID-19. Everyone wore a mask and none of the clients tested positive. Wear a mask. If not for yourself, then for others, for the elderly, for the young, for the unhealthy. The concept is risk reduction rather than absolute prevention. In an interview, a sign stated, "What you want is 100% of the people to wear a mask, but you'll sell for 80%. Then in a simulation, researchers predicted that 80% of the population wearing masks would do more to reduce COVID-19 spread than a strict lockdown. Now specifically, what is the problem with people in masks?
Have you ever been shopping for your household needs during a worldwide pandemic and you feel like you need to take down your mask, or you see others take down their mask to talk to store associates? Trust me, we have all been there. And Trust me, we have all been there. It's tough being heard when you have a mask covering your mouth. Things either come out as funny or you're never heard. But most importantly, getting contaminated with the virus is something that we all want to avoid. We have been quarantined and wearing masks for about a year now. Within each month, the average population has been less and less self-conscious about COVID. People are not keeping a 6 feet average. They're hanging out with their friends without wearing masks. And importantly, they're not following store occupancy limits. Because of that, people are getting sick and dying, or putting their older family members with low immune systems at risk. We want to be able to fix the need of people having to lower their masks to talk and making them feel heard with our exclusive inner voice mask models. Our products is not only comfortable, but it will be protective as well. We made designs for those who wear glasses, since they're the ones most affected by mask discomfort, and for people who don't wear glasses as well. On this next slide, you can see a graph of people who are working and affected by COVID-19. And on the right, you can see people wearing their mask improperly and properly. A lot of people are wearing their mask improperly because they can't breathe or they have a hard time being heard. We want to be able to avoid that by having people to wear their mask properly with our product.
People remove their mask to speak. Can teachers really do their job in mask? Teachers say, I know that is going to be hard for my student to hear me with a mask and face shield. Research suggests that mask can muffle speech and also make it more difficult or impossible for people with hearing loss. Dr. Gabriel Sandore, a senior researcher at Manchester, found that those with hearing loss face more challenge. He said they had more trouble hearing. and understanding what was being said, as well as feeling less engaged in the conversation and less connected with the person speaking. The mask we are wearing muffle our voice and can make communication frustrating. This is true for everyone right now, but especially for those people with hearing loss. 1 in 3 people between the age of 65 and 74 has hearing loss. Nearly half of those older than 75 have difficult hearing. Dr. Castle said, for people with hearing loss, wearing a mask created a double disadvantage. Dr. Dave Burby, the Chief Innovation Officer at SD Hearing Technology, told how social distance and mask can reduce the volume of speech.
Using a regular mask as time goes by with this pandemic, let's be honest, has become one of the most difficult things to do due to several reasons. The one reason we want to mainly focus on at the moment is when people have to lower their masks to speak because we're not able to understand what they're saying. There are different cases for this. For example, being at the store and having a question about something you're purchasing, but the person helping can't understand what you're asking, or you yourself can't understand what the person is saying. So, you would have to lower your mask to speak, obviously. Lowering your mask to speak can possibly increase the chances of getting sick and being sick. And being sick means you will grow fear of thinking you have COVID. But with our new invention, you won't even have to worry about lowering your mask, nor about getting sick, because we have a mask with the microphone installed, hoping to solve one of many issues this pandemic has brought to the world. There has been several stories on how a mask could help because people will lower their mask when their voice is not understandable. For example, there's been cases where myself, I'm at the grocery store, and I need to ask a question, and either the person is speaking too low or the mask we're at the moment wearing makes his voice not clear. In which this case, our masks can solve the issue. Another example is I have a friend who works in human resources. That when this whole pandemic began, he said he found it super difficult to understand when people came into the office with questions, which brought me back to the mask and helped me realize how helpful would a mask with the mic be.
Unfortunately for those who practice the proper safety precautions, encountering someone ignorant enough to pull down their mask just to talk is inevitable. It doesn't matter how safe a person is on their own. We've all come face to face with someone who flat out doesn't care or doesn't realize the risks that they're bringing. Most of the time, people will pull down their mask in order to speak, rather than simply talking louder. Invoice gets rid of this sort of risk entirely by amplifying our voices whenever we need. At the moment, there aren't too many options we could choose from. There are many voice amplifiers that we can carry around, but that's just another device we'll have to remember to bring along anytime we go out. Donut Robotics is currently working on and testing what they call a C mask. As you can see in the picture, there are As you can see in the picture, there are plenty of holes for the virus to escape and enter another person's system. Our inner voice mask aims to be a completely functional mask on its own, while raising voice volume and allowing for people to hear each other when being safe. These rough sketches display how our mask will look like. Underneath the microphones and speakers, the mask is still covering the person's mouth, which is the area that is most prone to spreading and catching the virus.
We have a variety of models to choose from when choosing from Inner Voice. Our standard model is equipped with a mic and speaker, which allows your voice to be understood by those around you. Simply press the button on the right to turn the speaker on. We need to let your inner voice out. No longer relieve yourself and others vulnerable while expressing a thought. The mic is detachable from our mask, so you can safely wash the mask and retouch the part back on. The speaker part is also chargeable with its own charger cable, so you can use the mask for the foreseeable future. If you prefer long-distance calls while outside, our Bluetooth model will act as your mic for your phone, perfect for when you're asking on the phone what to buy at the grocery store. Our Bluetooth model can alternate between speaking on the phone and speaking to those around you by holding a second button on the left. Holding this button will allow you to speak into the phone. Not holding on this button will allow you to speak to those around you. Audio comes with an earpiece attached to the mask handle. As humans, we are social creatures. You can now hang and talk with your friends, albeit 6 feet apart. You can safely repeat an order to a fast food employee. You can communicate with customers as a retail worker. You can lead a group of construction workers or a group of students as a teacher. You can even tell a total stranger they have a poor taste in clothing without the fear of spreading COVID. Warning, masks do not prevent users from being injured in the face. Insult strangers with caution. A vaccine for COVID may not come as soon as we want it, but we can assure you our masks will have a use outside this current dystopia. COVID is, after all, a disease, and it's not the only one of its kind. Whatever disease hits us, your inner voice will be there. Do you have a loose tooth, or perhaps you're wearing braces? No worries, you can wear a mask as many times you want to cover that spot for several months. Perhaps you're in a more chilly area, and you want to keep your mouth warm, but still want to communicate. You're practically finding more uses for a mask by the minute.
Now it is up to you to choose to be trendy and safe in this world with coronavirus. You can buy our masks at www.innervoice.com, and they retail for about $70. But I know it can be a little bit of pricey for an everyday user, but these masks will elevate your everyday experiences as well as they're reusable. So buy your mask today.